Welcome to our first video of Hughes Knows Nursing. I'm Veronica Hughes, and I am a nursing instructor and have been since 2018, and I know a little bit about a lot. So I'm going to try to share what I know with you guys, and hopefully it will help you in your journey to become a better nurse. So we're going to start out with acid-base imbalance, and just an overview kind of what you're thinking about whenever you're thinking about acid-base imbalance. And it is very intimidating at first. It is a very confusing topic, so if it feels a little overwhelming, that's okay. It just takes a little practice, and then before you know it, you will know all that you need to know. So basically, your body is obsessed with keeping you within a certain pH range. That happy spot is 7.35 to 7.45. Anything on either end of that, you're going to have a symptomatic patient. So anything lower than 7.35 is considered acidotic or acidosis, so more acidic from what would be considered a normal pH. And that's generally the acid-base imbalance we run into is acidosis. Anything beyond about 6.8, we're talking about death. So your body doesn't operate well if it's not within a sweet spot for acid-base imbalance. If we're going into the basic side, also called alkalosis, that's any pH that's greater than 7.45. And then if you're starting on that upper range, getting anything more than about 7.8, it's incompatible with life. So important, just memorize normal pH, 7.35 to 7.45. Anything less than 7.35 is considered acidosis, or a more acid state. And then anything greater than 7.45 is considered alkalosis, or a more basic state. And you'll hear those terms kind of interchangeably. So again, your body's working really hard to maintain this balance. There are different health problems that can affect this balance between acids and bases. Most notorious is things like diabetes. When we start talking about diabetic ketoacidosis, patients with COPD or any breathing issue really can have problems with acid-base imbalance. Renal failure also struggles with acid-base imbalance because all of those systems are used to kind of buffer these acid bases. Okay, so there's a buffer system, very basic, happens within the cells. Pretty straightforward. You can read about potassiums and cellular walls and shifting and things like that too. So read up on that. But the ones that we want to talk about that are going to be the ones that are more difficult to understand are the respiratory system acting as a corrective measure, and the renal system acting as a corrective measure. So the respiratory system is going to increase or decrease the rate of breathing, which affects the CO2 level. And CO2, if you have more CO2, it's an inverse relationship. So as you have CO2 go up, your pH is going to go down. As your CO2 goes down, your pH is going to go up. So that's how your respiratory system can help with that. And then your renal system regulates a compound called bicarb. And it also excretes some acid. So bicarb is a base. And so your renal system will hold on to the bicarb, which causes the pH to get more basic or to rise. And then if it excretes acid, then it can cause the pH to go down that way. So we use a test called an arterial blood gas, or an ABG is what you'll hear us call it, to determine this balance of acids and bases. So the terms that you need to know are pH, which we've already mentioned, 7.35 to 7.45. Then you have the PaCO2, which is just a measure of carbon dioxide. You have the HCO3, which is that measure of bicarb, or that base. So you'll see HCO3 and bicarb interchangeably. Then you have the PaO2, which measures the oxygenation status of your patient. And then you have just O2 sat, oxygen saturation. So the thing when you put it on their finger and it glows, and you get that magical number. The PaO2 and the O2 sat are different values. So different measures, there's different numbers associated with them. So they sound like they should be the same thing, but they're not. Okay, so back to normals. So the pH, we've already talked about 7.35 to 7.45. Anything less than 7.35 is acidotic. Anything greater than 7.45 is alkalotic. Then we have our HCO3, or bicarb. The normals for bicarb are 22 to 26. So another thing you just have to memorize. So bicarb, or HCO3, 22 to 26. Then you have your PaCO2, which is 35 to 45, which very conveniently matches up with your 7.35, 7.45. So you just measure or memorize the 35 and the 45, and you've got your PaCO2. So PaCO2 levels normal, 35 to 45. Then your PaO2 is 80 to 100. So just memorize that. Not delightful, but some things you just memorize, like a normal hemoglobin. You just need to know that. Side note, that measure of the PaO2, or partial pressure of oxygen, it's just a measure of the oxygen pressure in arterial blood. So remember, we call them arterial blood gases. You're getting the sample from the arterial system, not the venous system. And it reflects how well the oxygen is able to move from the lungs to the blood. So that's what that measure is. All right, so these alterations in acid-base imbalances occur whenever the compensatory mechanisms fail. And so if you've got a respiratory illness, then your compensatory mechanism is failing. If you've got a renal disease, same thing, you're going to have trouble with your compensation. There are different classifications of imbalances. We have either respiratory, which is a CO2 problem, or we have a metabolic, which is a bicarb problem, okay? And then you have acidosis or alkalosis. So are we acidic, or are we basic? And then you can have chronic versus acute. So some of these people just live with these acid-base imbalances because they have a chronic condition and the system's just always broken. So they're never going to be quite where they need to be. All right, so where do you start? So you always are going to start with the pH and decide, are you acidotic or are you alkalotic? Are you acidic? Are you basic? So anything less than 7.35 or kind of on that end is more acidotic. Anything greater than 7.45 is going to be more alkalotic. Then you're going to determine, is my problem with my respiratory system or my metabolic system? And we're going to go through how to figure that out. Then you're going to figure out, is my body trying to correct the problem? So if you have a respiratory problem, eventually your renal system is going to try to fix the problem if it can. If you have a renal problem or a metabolic problem, then eventually your respiratory system can act fairly quickly to try to fix the problem by adjusting the breathing. So we'll help you to learn how to determine if it's a full versus partial compensation, if any compensation at all is happening. And then there are complications associated with these acid-base imbalances, so being aware of what those are. And then as a nurse, what can I do? What kind of interventions can I put in place that it's going to help correct this problem? And then it's always good to remember, what orders should I expect? What kind of interventions are we going to do that can help this patient recover their acid-base imbalance? So, side note, it's really easy to get into the weeds with acid-base imbalance. You can have actually like combination acid-base imbalances. In ICU land, you can have one problem that's broken over here and another one that's broken over there, and then they compound to form this really stupid problem. Acid-base imbalance is really complex, but you can learn basics to be able to understand a good idea of what's going on. And of course, there'll always be more complicated things out there, but we want to teach you the most basic things, okay? So don't freak out. All right. So that's it for your introductory information on acid-base imbalance. We will move in the next video talking about my favorite way to break down acid-base imbalances and how to determine what you have based on lab data associated with ABGs. All right, thanks.